Hello class. Today we're going to be talking about multi-state outbreak of Salmonella infections linked to pot pies. So step 1, the background. The source of a Salmonella outbreak was banquet and store brand frozen chicken and turkey pot pies produced in a Conagra plant. At least 152 people were confirmed as suffering from Salmonella infections that had been linked epidemiologically and throughout laboratory testing to the consumption of contaminating pot pies between January 1st, 2007 and October 9, 2007. Each year, approximately 40,000 cases of salmonellosis are reported in the United States. So the number of confirmed cases is equal to 10 to 19 people, and the not confirmed is less than 20. Next, prevalence. The median age of patients was 20 years. The range was from 1 month to 97 years. 50% of the patients were female. A widely publicized Salmonella outbreak that was linked to frozen pot pies last year involved 401 cases in 41 different states and put more than 100 patients in the hospital. So some factors to be considered. Cultural factors, such as food consumption habits, attitudes towards food safety and health. Next, social factors, access to healthcare, public awareness, and education about foodborne illnesses. Lastly, economic considerations, which are the cost of implementing interventions, potential impact on industry and businesses. So some SWOT analysis. The strengths are strong collaborations between CDC, public health officials. The weaknesses are delay in identifying the source of contamination. The opportunity is to implement stricter food safety regulations. The threat is not addressing these concerns with consumers that can destroy trust in the public. Now, the main organization involved in this case is the Center of Disease Control, also known as the CDC, whose main mission is to prevent America from health and safety threats. Now, this CDC's mission statement is to maintain public health and security safety to stop the spread of disease, injury, and disability, whether it's a U.S. or a foreign country. So root causes. What are some of the root causes? Some causes that lead to the spread may be from raw ingredients or even cross-contamination. A study conducted on the Salmonella outbreak was due to the consumption of banquet pot pies and explored following root causes. Also, the lack of effective surveillance systems. Lastly, the opportunity to implement stricter regulations and guidelines by the CDC and FDA. Next, theoretical perspective. Social ecological model, also known as SEM, can be applied in this case in the following ways. Individual, which is education, interpersonal, with peer support, organizational, with compliance, community and collaboration, and lastly, policy and regulation. Alternative solution, introduction of irradiation technology to effectively eliminate pathogens in food products. Next, implementation of hazard analysis and critical control points, such as known as HACCP, system in food manufacturing processes. Some recommendations. Research demonstrates the effectiveness of irradiation in reducing microbial contamination in food products. By identifying critical control points and implementing preventive measures, the HACCP system can help prevent future outbreaks. Strengthen collaboration and communication between public health agencies. Lastly, these recommendations collectively aim to enhance preventative measures, leverage advanced technologies, and improve the collaboration to mitigate foodborne illnesses. Action plan. What's our action plan? Our action plan is research and training sessions that should be implemented for food manufacturing processes. Next, food manufacturing managers and public health agencies should be held responsible. It should be in a limited time frame. Training sessions are 3 months and feasibility research are 6. Lastly, implementation of collaborative strategies are 9 months. So to conclude, our conclusion is pretty much wrapping everything up by combining recall measures, enhanced sanitation protocols, and public education campaigns that the situation can be controlled. Next, investigated a foodborne illness outbreak in the United Kingdom in 1991 caused by contaminated ready-to-eat meals. The solution involved a combination of product recalls, also improved sanitation practices, and last but not least, public health campaign. In my opinion, to prevent the spread of salmonella on pot pies are: first, source control, and that is to ensure that raw ingredients, especially poultry and vegetables, come from reputable suppliers with strict food and safety standards. Next, to implement supplier verification programs to ensure the quality and safety of incoming ingredients. Next, good manufacturing practices, also known as GMP, and that is to establish and enforce stringent GMP in the production of facility, including proper hygiene practices, employee training, and equipment sanitation. Also, cooking procedures, to follow recommended cooking temperature and times for all ingredients, especially poultry. Next, quality assurance, to implement a robust quality assurance program to regularly test and monitor raw materials and finished products for the presence of pathogens, including salmonella.